Welcome to Colorado State University's Paging Dr. Ram. Tonight we're going to be talking about wound management and all the different aspects of that, both from anatomy and all the diagnostics that you can do, and then the therapy. So I am Dr. Swain, Elsbeth Swain, and I am part of the CSU's ambulatory service. And I'm here today with a wonderful group of people to speak to you, one of whom is Dr. Luke Bass and Dr. Alicia Yoakum. So if you two would like to take a minute and introduce yourselves, and then we'll get started.
Cool. Thanks, Dr. Swain. Again, like she said, I'm Dr. Luke Bass. I'm here with the Equine Ambulatory Service at CSU. Finished veterinary school here now 8 years ago, and practiced at Pioneer Equine Hospital in California for a period of time, and returned back to Fort Collins 2 years ago to join the Equine Field Service team. Very happy to be part of these Google Hangout sessions. This is the third one that we've done and have done quite well. So thanks again for joining us, and I will turn it over to Dr. Yoakum.
Hi, I'm Dr. Alicia Yoakum. I'm also part of the CSU Equine Ambulatory team here in Fort Collins. I graduated from UC Davis in California and did an internship at a private practice in Virginia before coming here. And I'm excited to help everyone learn a little bit more about anatomy tonight.
Thank you, Dr. Yoakum and Dr. Bass. And just a little bit about myself. I am from Colorado originally, and have just come back this last year, and it's been great to be back. I took a internship year in Wisconsin and then 3 years of residency in California in internal medicine, and so it's great to be back. So Dr. Yoakum is going to get started with the anatomy section of wound management. So Dr. Yoakum, take it away.
Okay, so I'm going to talk a little bit about location of wounds in your horse and why some areas might be more important than others. So we'll start with anatomy. We'll just kind of show a picture of kind of some important systems, body systems in the horse before we go to specific locations. So we have the skeleton, so horses have lots of bones, and as you can see here, especially in their legs and their face, they don't have a lot of muscle covering their bones there, so that's something we'll keep in mind as we go along. Muscles, horses have lots of muscles, and as you can see here too on their lower limbs, they don't have a lot of muscle cover over their bones and their tendons and ligaments. We'll talk a little bit about the abdominal cavity and why wounds underneath the horse might involve the abdomen more than we think. The respiratory tract we'll talk about a little bit as well. We'll briefly touch on some wounds that have involved some vessels and nerves, and this is just kind of a picture to show you briefly that there are a lot of vessels in the horse, and so wounds can involve those. And we'll start with the head and the neck. So horses have large eyes that sit on the sides of their heads, and they like to explore things with their nose and their muzzle, and so these are a couple of locations that are commonly involved with wounds in our horses. Eyelid lacerations are pretty common, again, because the eyes sit big on the side of the horse's head, and it's really important that if you see a laceration or a wound like this in your horse that you get it treated very quickly, because as you can see here, we can repair the wound so that the eyelid goes back to sitting exactly where it was before, and the eyelid is very important in the function of the eye, and so if it's not put back together as accurately as possible, the function of the lid can be compromised. Another thing that often happens with horses with eye wounds or eyelid lacerations in this case is that they can develop corneal ulcers. So this little green is a stain that a veterinarian put on this eye to find an ulcer, and often when horses' eyes are injured, they develop these ulcers, and these also need to be treated quite quickly and aggressively by your veterinarian, because corneal ulcers can impact the vision and the health of the eye itself. So head and neck continued. We have lots of vessels, lots of vasculature, arteries, and veins on the head, as you can see in this drawing. And these are just a couple examples of wounds that involved pretty large vessels. This farthest to the right image, you can see obviously that that vessel was just very prominent and obvious that it was affected. But the picture in the middle, this horse wouldn't bleed unless its head was down. So there was a large vessel involved that had been severed, but when the horse's head was up, it was sort of occluded or stopped by the muscles and the bone in the head. So just important to have these wounds really thoroughly evaluated. Horses have lots of nerves as well on their face and their head, and the facial nerve is this big yellow one in the drawing, and it's very close to the skin, and so if a horse is injured and that nerve becomes injured, they can develop what's called facial nerve paralysis. In this image, you can see the horse's left ear and his nose are both kind of drooping. And so when they develop this condition, they can have other complications as well, including that, again, going back to the eyes, their tear production may not be as good as it was before, and that can predispose them to corneal ulcers as well. So again, anything that looks abnormal in your horse's face after a wound happens should be addressed by your veterinarian. The horse's skull, or the bones of the head itself, are large, and they have these large air-filled pockets called sinuses, and they're on the sort of front of the face and on the side. And some more severe wounds, like this one on the right, can actually involve the sinuses themselves. So again, these are important anatomical structures to the horse and do need to be looked at by your veterinarian. The horse's trachea and the esophagus are very crucial to the life of your horse, and if they are compromised in a wound, that can be very serious and potentially life-threatening. And so I just wanted to kind of show how the trachea and the esophagus run on the underside of the neck. And so wounds that happen on the underside of the neck may be more rare, but if they do occur, they can be quite severe. The horse's thorax, or the chest, which includes its lungs and part of the respiratory tract, wounds that occur in this area can also be very serious, and this yellow outline shows kind of the outline of where the lung would be on a horse. And both of these wounds are or potentially could be involving the internal structures of the thorax, which will put the horse into very severe respiratory distress, breathing very hard, very agitated, and these require very immediate veterinary care and attention. The abdomen of the horse, or basically the part of the horse that contains all of the intestines and gastrointestinal functions, are much closer to the skin than maybe we realize, or you guys might realize. And so I just kind of wanted to show, both with these pictures, that a wound that happens on the underside of the horse's belly or up into the groin region, like in this picture with this stick, may involve the abdominal cavity itself and may potentially also penetrate into intestine itself. And so these can be quite serious and do require veterinary care to make sure that this hasn't happened to your horse. They can develop infections of the abdominal cavity. They can develop hemoabdomen, which is when they bleed into their abdomen itself, both from trauma that goes directly into the abdomen and then also from blunt trauma to the outside of the horse. Limbs, as we all know, horses' legs can be quite fragile, and so we're going to talk a little bit more in depth about the bones and joints and other structures of the limbs of the horse. These two images, the one on the left with all the bones is all of the bones in the front leg, and then we have all the bones in the hind leg. And in this picture, I kind of wanted to show where the bones exactly go on the horse's legs. And so here we have the front leg bones in line with this horse, and then the hind limb bones. And so where the bones meet are the joints, and if we ever have a wound that goes into a joint or another synovial structure, which might be a tendon sheath or a bursa, These are need very immediate veterinary care and need to be treated very aggressively as soon as possible. Wounds that go into joints or bursas or tendon sheaths can wind up leading to compromise of those structures and eventual, potentially lifelong lameness. And so we want to see these as soon as possible and treat them as soon as possible. Some of the names of the joints we have on the front leg: the shoulder, then the elbow, and the carpus, which we often call the knee, in the upper part of the leg. And then in the hind leg, we have the stifle and the hock. The hock's also called the tarsus. You may have heard that term. And then both have the fetlock, pastern joint, and coffin joint as the lower three joints in the horse's leg. So I wanted to show some example pictures of wounds that occur in the lower limbs of horses, and these are all wounds that have involved either joints or a tendon sheath. And this first picture, this wound involves the coffin joint. In this second picture, the middle one, the wound involves the pastern joint. And this third picture on the back of the leg involves the digital tendon sheath, which there's a little drawing over here on the right that shows kind of the extent of that. And it, again, like I said, is a synovial structure. It holds the deep and superficial digital flexor tendons within it. And if it becomes compromised by a wound, that can very significantly compromise the horse's soundness if it's not addressed quickly. The carpus and the tarsus, again, the tarsus is also called the hock. I just wanted to show how sort of complicated these joints can be. They all have multiple layers of joints, and then in the drawings, the little green tube-looking things are more synovial structures that contain the tendons and ligaments as they run down the leg. And so any wound to your carpus or your tarsus, also called the hock, can be very serious and involve any one of these little structures. So the horse's lower legs have tendons and ligaments, which I'm sure most of us are familiar with. Either can become damaged with wounds or just from exercising your horse. And so it's important to know the extent of how those structures have been injured as well. And then you can also see in this drawing how close the bone is to the skin surface and that there's just not a lot of muscle or anything really covering it. And so when bones become compromised in wounds, they also need to be treated aggressively and addressed quickly. This middle picture, this horse had a wound that compromised its deep digital flexor tendon and ruptured it, and that causes the flipped up appearance of the toe. And this last picture, this wound, maybe on superficial appearance, doesn't look very deep, but when we looked closer, it looked like it involved the suspensory ligament and maybe some other soft tissue structures. And then it also wound up having a fractured splint bone. So again, the bones are very close to the surface, and these wounds can be more significant than we might realize on first glance. Another thing that horses like to do with wounds is develop proud flesh or excessive granulation tissue. Especially in their lower limbs, they have lots of motion, they're always moving, and so when they heal, they don't have a lot of skin often to cover the wounds to start with, and so stitching them up is not always very easy. And so when they heal, they develop this excessive tissue, and it does wind up needing to be trimmed away by your veterinarian so the skin can eventually close over. And this middle picture shows a nice image of proud flesh, and then the first one, that's how the wound looked on the first day we looked at it, and as it healed, it developed this bed of proud flesh over it. So just an example of how these wounds heal, and they kind of wind up needing prolonged care as the wounds heal over time. And then briefly, I just wanted to show a few pictures of wounds that can happen in other locations than what we just talked about, and how they may be, again, more significant than realized at first. This first wound was a stick that had got stuck in this horse's hip, and after looking at it further, we found that it had actually fractured the bone within the wound. And the second picture shows a big laceration over the shoulder. There's a lot of muscle, which does heal very well, but it's a kind of a reminder picture of that in horses, oftentimes, even if we fix the wounds, there's so much movement in these locations that it can be hard for them to stay stitched together. And then the third picture is a horse that clamped its tail over an electric fence. And just kind of wanted to remind everyone not to forget that the tail also has bones within it, and these locations should not be ignored. So with that, I will turn the slides over to the next lecturer.
Thank you, Dr. Yoakum. That was fantastic. I am going to now take it to what you can do diagnostically for wound therapy. Okay, so for diagnostics, one thing to begin with is to, from your standpoint as the owner, but also from the veterinary standpoint, it is very important to be thorough when we're looking at a horse that's been injured. You can get very distracted by the obvious and the big, larger wounds and maybe miss something that's more important and more significant. This wound is happened over a knee, and there's a tiny little puncture that has occurred right there, and that can be more significant to the horse in the long term than the larger wound on the chest. We begin our first assessment with horses with wound preparation, and so this involves clipping of the hair. And one thing that is very helpful to when we're clipping the hair is to protect the wound itself, and we can add surgical lube to the wound bed so that the hair doesn't stick to the wound when we're clipping, which is really nice, especially in the winter time. And then cleaning of the wound really helps us, and oftentimes, especially in rainy weather, it is and muddy weather, it's mud caked and very difficult to see how deep or extensive a wound is. And so taking the time to clean the wound before, in order to assess it, is really important. Some of this you can do very safely with just cold hosing if the horse is good for it, and then using gentle soap and water. It can help you see how deep the wound is itself and determine how severe it is. And then one thing to remind you is with any type of wound preparation is to be safe and pay attention to your horse and its sensitivity. Most of these wounds can be very painful, especially if they've just occurred. And so just a reminder to stay very safe and use a veterinarian if in doubt at all. Another thing that we can assess is the contamination of the wound. Is the wound infected? And this wound on the left is a wound that has happened just recently within a few hours, and then the wound on the right is one that's a little older and then has a lot of drainage associated. This is when the bandage was taken off of the wound and the bandage was soaked with some debris and discharge, and so it indicates to the veterinarian that it is infected and requires other treatments. Another thing to assess is how old the wound is. Dr. Yoakum talked about the granulation tissue or the proud flesh that can develop in the later stages. So this picture on the right is a very new wound with sharp edges, and the tissue underneath looks very normal and does not have any proud flesh associated with it. So this is going to be a more acute wound. And then the picture on the left has significant amount of fluffy pink material, and that is the proud flesh occurring in an older wound. So that helps us gauge, sometimes if we can see the granulation tissue, it helps us gauge how old that wound is, how many days it's been. The location is so important, like Dr. Yoakum talked about with especially the lower limb. There's so many structures that can be involved, and so that we begin a wound exploration with consideration of all of the anatomy and the possibilities for complications to the structures that are around the wound. Punctures are especially tricky because they look so small from the outside, and yet they can be they contract underneath the skin, and you don't really know where they are heading, and so they can go into the deeper structures of the joint capsule or tendon sheath, and you may not know it until a few days later. And so exploring puncture wounds is very important. And then the more obvious wounds, it's a lot easier to identify the structures that are involved, and the larger surface area helps you with that. You can use instruments to explore the wound as a veterinarian and try to understand how deep the wound is and the extent. And most of this we do sterilely so that we don't track with our probe more infection or contamination anywhere into the wound or to the deepest extent. And then you can identify what structures are possibly involved and what should you be considering as part of the therapy. There are many diagnostics that we can reach for when things are maybe a little more complicated. And so some of the things that we use as our guideline on when to look a little deeper at the horse is if the synovial structures are involved. And so that, like Dr. Yoakum talked about, or the joints or tendon sheath. If the horse has a wound and then is also severely lame or develops an increase in lameness over the course of healing. And then another thing that we really consider with wounds and reassessing wounds diagnostically is when they're not healing appropriately, like you would expect. And then tendon and ligament involvement too. Sometimes we have to use other techniques in order to identify the integrity of those structures. So to begin with, wounds over the synovial structures, this is a wound that has happened to the back of a front leg and has punctured into the tendon sheath. And so the tendon sheath has developed a severe swelling around it, and the wound itself looks pretty small, but the swelling is significant, and likely the tendon sheath is infected. And so things that you can investigate is that you can actually sample the synovial fluid. So that's the fluid that surrounds either the tendons in the tendon sheath or in the joint cavities. That's what kind of lubricates the joint and supports the health of the joint. And so you can actually do this sterilely, and as a veterinarian, you can stick a needle into the joint and sample the fluid, and you're assessing the color and the viscosity of the fluid, wanting to make sure that that appears normal. And then also you can measure the cell numbers inside the fluid and protein. As the cell count increases or protein increases, then that indicates to you that the horse has a compromise of the integrity of the synovial structure. This is an example of, the last picture was a very, very normal looking fluid, and this is a more contaminated looking fluid, an infected fluid. And so the fluid is thicker and it is a darker yellow. And so this is definitely something that you would want to culture as a veterinarian. Other things that you can do to assess the integrity of the joint are you can also distend the capsule of the joint by adding sterile fluid to the joint itself. And so you just expand the pressure in the joint and see is the fluid coming out of the wound. And so this joint that has a wound on the outside of the leg, and the needle's going on the inside of the leg, and the arrow is pointing to the fluid that's coming out the wound itself, and it shows you that the wound has affected that fetlock joint. Even if all the structures appear intact, antibiotics can be injected into the joint that you're worried about being associated with a wound, just to help protect the joint and give it extra support. Other times that we look deeper into and use other forms of diagnostics are when the horse develops a moderate to severe lameness. So sometimes this can occur at the time of injury, and then sometimes this can develop later in the healing process, even a few days later or a few weeks later. And so this can really help determine what is going on and give you an idea of how to proceed diagnostically depending on the time of onset. infection can occur with some of these lamenesses, especially if they are occurring a few days after injury. And so that's something that we want to revisit as veterinarian, to maybe re-tap a joint or retest the fluid. We always wonder, is there bone involvement, and especially with wounds that are not healing. And then this injury is to the inside of the hind leg, and then you can, when it was explored, you could see tendons and ligaments involved. And so this may be something that you have to assess over time with ultrasound to try to see if it is the tendons or ligaments have been compromised. So to evaluate the bone, this was the case that Dr. Yoakum gave as an example. And this one, we were concerned about the soft tissue structures with the tendons and ligaments, but the lameness and the appearance of the wound and the horse made us take radiographs, and that x-ray was very important so that we could identify the fracture of the splint bone that you can see here. And so sometimes with the lame horses at the time of a wound, the radiographs can be extremely helpful. Other times that radiographs are used are in non-healing wounds. So this was a wound that occurred on a horse's leg. It was a hind leg, and it was a few weeks after injury, and it was just a tiny little laceration, but it just wasn't healing appropriately. It still had a lot of granulation tissue and a little bit of drainage. So this x-ray was taken, and you can see a lot of reaction at the arrow, side of the arrow, and that just is a fluffy appearance to the bone that indicates that the bone is involved, and it should maybe be considered as far as being infected itself, or the bone being infected, or having another problem. Other things that you can do to evaluate bone would be, in addition to radiographs, would be ultrasound. Sometimes you can evaluate the surface of the bone with the ultrasound. And then more advanced imaging would be CT or MRI. This is an MRI image of a bone, and that the middle bone has a white patch in it, and that bone has a lot of inflammation within that, and the x-rays were normal. And so very interesting that that was the cause of the horse's lameness, that just got a bone bruise. And then you can also use things like bone scan for more advanced or complicated cases. Using ultrasound to evaluate either the soft tissue or the bone is very useful. And so this is an example of a non-healing wound that ultrasound was used to evaluate the surface of the bone, and on the picture on the right, you look at the white line running down the screen, and it kind of breaks away in the middle, and it should be a nice clean white line all the way through. And so there's a pocket of infection, and also a little sequestrum of bone that has not healed down and was injured in the original injury that looked pretty superficial. Other times that you use ultrasound are to evaluate the ligaments and the tendons, and sometimes we have to wait until the inflammation is quieted down, and this can be up to a few weeks after the original laceration or injury, and then we can assess adequately the integrity of the tendons and ligaments. So it just depends on the wound and the severity and how quickly that inflammation resolves. The non-healing wounds, the most important thing is to go back and repeat the diagnostics, because infection can play a role, bone changes, deeper pockets of bone bruising or injury, and also tendon or ligament injuries too. And so all of those things can really be important and change over time. Some fractures may not show up for weeks after the original injury, and so repeating radiographs in order to try to find those structures can be extremely useful. And then certainly repeating cultures if the lameness is not improving or the infection does not appear to be improving despite antibiotics. And then certainly you can use advanced imaging to see further detail, and there's so many structures involved, and so those can be extremely helpful too. This is a little tiny bump on the bone. There was a soft tissue injury, and the horse probably got kicked, and the bone got bruised, and then a little section of the bone died around the original injury, and then sequestered off a piece of it. And so until that bone is cleaned up and that little section has been removed, that bone or that wound on the external aspect won't heal. So to decide when to call the vet, remember that it never hurts to call. We are always happy to at least troubleshoot and look at pictures if you have them, and try to help you decide if it's indicated to have the vet out. And then especially call the vet, though, if you are looking at a puncture wound, or your horse has a concurrent lameness in addition to a new wound, or if the wound has occurred over joints or any other structure that you would be concerned about with a synovial structure or tendon or ligament. And then certainly for non-healing wounds, because that can also, there are a lot of things that we can do to help troubleshoot and try to figure out why it's not healing. A reminder that you can submit questions as a comment below as you're watching this whole presentation. Next up, we have Dr. Bass, and he will be talking about wound therapy.
Thanks so much, Dr. Swain. A great introduction to anatomy and diagnosis and why we do what we do with wounds. Now we'll conclude this session with wound therapy. So just to begin, you've heard a lot about lacerations. They do come in all types and varieties. You can get something from a simple abrasion to something that involves tendons, joints, or major vessels and nerves. To begin this part of the presentation, we get a lot of questions about what do I clean my horse's wound with. We recommend using povidone iodine, which is called betadine. It's the gold standard. There are many positive reports by using this. It has benefit of being an antiseptic, but it's also associated with having debridement as well. There's been some studies that have shown that topical antibiotic sulfur sulfadiazine, povidone iodine, or saline galls works, but the povidone iodine seems to be least effective in reducing bacterial numbers in the wound. So we like to use it. We also we'll follow it with antibiotics systemically and most likely topical, but it's the gold standard as far as what to clean a wound with when it happens, or maybe after the veterinarian looks at it and assesses it and goes from there. Then from that point on, we probably need to assess what to put on the wound once it's dealt with, either after the veterinarian has sutured it or after you've taken care of it. There are a couple of products that we like to use. One is silver, and it comes in, we call it SSD cream, but it's the sulfur sulfadiazine cream. It's used quite commonly in human burn patients, but we like it for certain wounds on the horse. The cream is removed and replaced at least once daily, and there's been some reports that show that silver in horses has less granulation tissue. And like you heard from Dr. Yoakum, granulation tissue sometimes can be the #1 problem in horses that have distal limb wounds. Nitrofurazone, this has been around for centuries. Nitrofurazone has been compared to the others, and actually shows significantly slows the healing rate. We recommend not using nitrofurazone for most wounds. It does have a toxicity to cells, and it just basically has minimal effect against the microorganisms that can cause infection. So at this point, we do not recommend using nitrofurazone directly on the wound as a wound ointment. One ointment most commonly used that we recommend using is what's called triple antibiotic ointment. It has neomycin, polymyxin B, and bacitracin in it. There's a huge benefit of this medication when used or when compared to other topical antiseptics. Antibiotics do help in working in a synergistic fashion, so they basically feed off of each other. one of the big things in wound healing or wound therapy is keeping the wound moist, keeping the environment moist. And so this one product basically reduces bacterial numbers and is more beneficial than the others in stimulating wound healing. So at this point, we're either looking at using Neosporin or the silver for a topical wound dressing. A newer concept that has come out in the last 4 or 5 years is using Manuka honey. There are several sources. You can either purchase this online from your veterinarian, but it works in several different ways. It's an antibacterial, works as an anti-inflammatory as well. And how it works is the high sugar content, and basically the makeup of the product helps draw edema or swelling out of the wound. It also pulls the water out of bacteria and is acidic. In addition, it promotes wound healing and effective for proud flesh. So this is something that I have started using in the last 4 to 5 years that really helps provide a more natural approach to wounds, and it's pretty readily available in most parts of the area. Sorry for the graphic nature on this wound. This was a wound that I saw when I was in California, and you can see on the left picture it's a pretty significant wound to the right fore ankle. You can see the cannon bone is visual here, and it was in the digital tendon sheath there. And this is a picture 3 months later of Manuka honey and actually meat tenderizer, which I learned as a youngster to use on wounds. So you can see significant healing with this wound, and nothing else was done other than the Manuka honey and the meat tenderizer. Like I said in the beginning, moist wound healing is very important. A full thickness wound must be kept moist, and usually will re-epithelialize, or will start to close over in 12 to 15 days. When compared to the same wound exposed to air, will take twice as long to heal. So the old verbiage of it needs to be exposed to air may not play safe or may not play correct for our current wound healing. The other idea that I wanted to talk about tonight that a lot of people don't know as much about is the concept of foot cast. So as you've been hearing throughout tonight's sessions, we get a lot of wounds on the heel bulb area, around the coffin joint, or anywhere in the pastern or around the fetlock. And so one option for these wounds, obviously after you assess to make sure it's not in a synovial structure, is to suture the wound and then place it in a foot cast. And there'll be some pictures in the next slide that shows the foot cast, because this is just the light bandage. But what this does is this immobilizes the foot significantly for the first 3 or 4 weeks of healing. And so this speeds up healing, and it allows you not to have to change a bandage 2 or 3 times a week like you would have to do in bandaging. And yes, there is a bit more of an investment at the beginning, but after the 3 to 4 weeks, your actual investment is the same when spending money on a foot cast versus the bandaging 2 or 3 times a week. So on the left, here's a picture of the foot cast finished. We have regular casting material, and we use elasticon on the top and bottom of this. And this is actually a picture of the same horse after the foot cast has come off. So a little different wound that was showed in the previous slide, but you can see that wound is basically healed, and the horse is almost ready to go back to work. So pretty impressive results for only 3 or 4 weeks of a foot cast. The other concept that was done on this horse recently is the idea of skin grafting. And I think Dr. Yoakum did a great job of talking about proud flesh. And I'm going to, if it's okay, skip over basic wound care as far as bandaging goes. I wanted to get in and talk about some of the cooler things that we can do both in the field and in the hospital here at CSU. You can see this mare sustained a wound to her right hind cannon bone region, and this is just below the hock. You can see the cannon bone was exposed. This wound was sharply debrided and placed under a bandage to basically let a nice bed of granulation tissue heal over this wound. And due to the size and the time it would take to heal, the owner wanted to do skin grafting. And so we took the students down, did this in the field, and you can see this is the recipient site, and we've made some little punches in here and stuffed some little Q-tips to keep the bleeding down. And then we're going to take these donor sites from just under the main, and we're going to stick them or plug them into the holes that the Q-tip is on. That was done, and this is the wound about 3 weeks after that procedure was done. And the wound is actually healing quite nicely. I was just unable to get the picture today for a more updated picture, but you can see, taking it from where we started and where we finished, it's healed quite nicely, and it's done quite well. So I know we've touched on some ideas about wound care, and hopefully we've given you some ideas about where wounds are bad, what to do with those wounds, what your veterinarian is going to do, and just a hint of what we're going to do. This is a book that we all have. It says here for the equine practitioner, but anyone can buy this book. It was written by Dr. Dean Hendrickson, who is on staff here at CSU with us. It's a great resource for how to deal with these wounds, and it's a great resource for what to do if you just have questions. And this is the source to get it from. Again, if you're not able to tune into all of this, session will be on YouTube for further viewing. And I think that concludes the presentation part of it. I'll switch things over back to Dr. Swain, and she can pose some questions that were asked by the audience.
Thank you, Dr. Bass. That was great. Okay, so we have a couple questions that we're going to get started with today. The first is from Julie Dyer. She says, I have a gelding who has a swelling in the sheath area. I was told it could be due to lack of exercise. At what point does this become a big concern? He seems to be feeling fine otherwise, except itchy in that area. His pen has a drainage problem and has been muddy with all the rain. He was examined and cleaned out by my vet 1 week ago. No lumps were found, but there was a little discoloration noted. In your opinion, what might cause the swelling, and what would be the best path to healing? So I'll answer that question. It depends quite a bit on how old the gelding is and what breed he is. And so sometimes I get concerned about, if it was a paint horse, about squamous cell carcinoma. If it was a gray horse, I get concerned about melanoma. But otherwise, older geldings have a really big tendency to get swelling in the sheath region and to have a hard time seeming to clear that swelling. It doesn't normally cause many problems for them at all. Sometimes it can get more pronounced and then kind of wax and wane. And certainly if this is something that is new, sometimes I recommend blood work just to make sure that there's nothing else going on that you might need to follow through with. And then certainly having your vet do the exam recently was a good idea. So, okay, there's a couple other questions. We've got, okay, this question, if my horse sustains a wound to the fetlock and it is bleeding a lot and squirting blood, what do I do before I call the vet? Dr. Bass, would you like to head up that question?
Of course. Great question. We see this or hear about this probably once a month or so. So when someone calls and says, poses this question to us over the phone, I immediately know that, in the fetlock or pastern region, there's some pretty good, sized vessels that supply the blood to the foot, and most likely the laceration has involved one of those vessels. I think the first recommendation I would give owners, before you call and kind of in a panic attack about the bleeding, is try to find something to cover it with, and that's not always easy because you may be on the trail, or you may be at an event, or you may be in your backyard and just don't have anything handy. But even something as simple as a towel or a t-shirt or anything that you can apply pressure to the area and wrap that with, it would be nice to have vet wrap or elasticon, but even if you had some duct tape, just get a nice firm pressure over the area. Maybe put the horse in a stall or a confined spot where he or she can kind of chill out until you can kind of regroup, call the veterinarian. But getting the bleeding stopped is great. I don't know if I would recommend giving the horse any medication at that point unless they're severely painful, but I think at least getting compression over the wound, getting a bandage on it if you have the materials, but if not, using a thick towel or something to apply pressure and some duct tape at the least until we get there is a great idea. And then once we get there, then we can take it off and ligate the vessel and assess where things go from there. But that is the recommendation I would give for that approach.
Okay, thank you. Another question, if my horse steps on a nail, what are the correct steps to take? Dr. Yoakum, would you like to handle this question?
Sure. So if your horse steps on a nail, the first thing that you should do is not take out the nail. We usually like to see the horse with the nail still in the foot, and that way if we take an x-ray, we can see where the nail track goes. If you do have to take the nail out, if you're going to transport the horse or you or feel the need to take the nail out for another reason, marking the area or trying to do something that will tell us where the nail went in is very beneficial. It's much easier than you would think to lose the nail tract. So call your veterinarian, leave the nail in if possible, and if you're very far from your veterinarian, you could discuss with them whether putting the horse on a trailer and taking them to a clinic or taking them to your veterinarian is an option as well.
Thank you, Dr. Yoakum. Okay, another question. My horse had a wound to the digital tendon sheath area. Should I rush him to the hospital or have a local vet see it? Certainly some of this depends, I can answer this question, some of this depends on how close you are to the facility and what vets are available to you in your area, but definitely having a veterinarian take the first couple steps even on the farm can be very helpful, because that can sometimes, just that wound exploration that you can do on the farm with your veterinarian can rule in or rule out the involvement of the tendon sheath or the other structures that could be involved. And so sometimes there can be even fractures or other things that you may want to stabilize first before transporting to the hospital. But if you don't have a veterinarian available and your only option is to take the horse to a referral center, then certainly that's something you can do. Okay, another question is, on the trail, my horse got kicked and sustained a puncture wound to the hock area. What do I do next in this situation? Dr. Bass, do you want to handle that question?
Sure. I think it's the time of year when people are finally, able to get out on the trail, enjoy their horses, and so this is something that we never want to hear from an owner, obviously, as unfortunate as it may be, but it does happen. So I think our first recommendation is to include a first aid kit with you, and that would include certain bandage material, anti-inflammatories, maybe some eye medication in case there is an eye wound, and definitely some medication to help you along the way. And from there, if you have that handy and you're near your trailer, it's easy. You can bandage the horse and try to get it to the veterinarian. But the difficult situation arises if you're 8 to 9 miles in your go and something happens. And so I think as hard as it may be to take bandage material with you on the trail or take a couple of items in your saddlebag, that's probably the best thing to do in applying a bandage. If you had something to clean the wound, that's wonderful. But puncture wounds to the hock or even to the knee or any of the areas of the joint, as you've heard tonight, are a huge concern. So trying to get the wound clean and get it covered to prevent any further contamination would be the best bet. And then if you had any bute or Banamine, an anti-inflammatory, probably it's a good idea to go ahead and administer the proper dose of that until you can get back and get down and get to a local veterinarian or a referral center. So I think the point I'm trying to make is, having materials on the trail with you or while you're camping is really handy. And if you take them, you'll probably never use them. But if you don't, then you'll wish you had. So I think preparation is the key, and then trying to treat the wound as best you can to get to that veterinarian is also probably the second step, and then we take it from there.
Thank you, Dr. Bass. Okay, that wraps up our questions for now, and certainly you can continue submitting questions by clicking below or commenting below, and we'll do our best to try to continue to answer any questions that you may have. And then you can view this whole presentation, all three of the speakers, in the future. It'll be posted on YouTube. you can find us there. Paging Dr. Ram, Colorado State University. And thank you so much for tonight. And we appreciate all of the viewers, and hope all will have a nice evening. Thank you.